Okay. Which of the following conditions is most commonly associated with this patient's clinical presentation? Behçet syndrome, Lyme disease, sarcoidosis, SLE, or tuberculosis. A 28-year-old woman presents to the clinic with painful red nodules on her lower legs. She also reports experiencing jaundice, joint pain, and a low-grade fever. A physical exam reveals tender erythematous nodules on the anterior aspects of her shins, and a biopsy of one of the nodules shows septal paniculitis. So, sounds like some sort of like erythema nodosum is like what's describing the painful red nodules. She's also got like the fatigue, joint pain, low grade fever. That suggests some kind of like autoimmune issue. Um, so it's probably not Lyme disease. The red nodules doesn't really match like the bullseye rash or like really any of the later symptoms of Lyme disease, even if he didn't have the rash. Sarcoidosis doesn't exactly fit. You'd probably see like some sort of chest x-ray or chest symptom, some sort of cough. Um, Lupus doesn't exactly fit this picture. I mean, yes, she's got the fatigue, joint pain, low grade fever. She's the right age for it, but I think that's not exactly the derm that I'm expecting to see. TB doesn't match the presentation. I'm gonna go with Behçet syndrome.
Okay, so this one's kind of interesting here, right? So she does have kind of this erythema nodosum, right? But it's usually caused by different kind of autoimmune disorders. Okay, but in particular, right, she fits kind of the symptoms of fatigue, joint pain, low grade fever, right? You have these skin symptoms, right? But Behçet syndrome. Do you know what Behçet syndrome by any chances?
I'm like vaguely remembering the name right now. I want to say it's like in the oral chapter.
Yeah, you get ulcers. You get a bunch of ulcers
That's what it
everywhere,
is.
and also eye issues, right? And you can get erythema nodosum with this, but you usually typically not with any kind of joint pain, right?
Yeah.
Of course, you're gonna get fatigue if you have ulcers all the time. Lyme disease, right? Usually they talk about the targetoid rash, right, from a tick bite, things like that. You can have some heart stuff. Sarcoidosis, you're going to have a little bit more respiratory symptoms, but you can have erythema nodosum, and then TB, you're going to be coughing up a blood, right? Night sweats, fevers, chills, things like that. So best answer here would probably be lupus because she has a hodgepodge of things, right? Some skin issues, some joint issues, some fatigue, right? And apparently, I didn't know that, but septal paniculitis, right? Yeah, don't know what that is. So, but something I learned today too.
Now we know.
Now we know.